Welcome to this explainer. Today, we're unpacking a story that has literally sent shockwaves through the global travel industry, fundamentally changing how we look at remote, high-end adventures. We're talking about the MV Hondius Hantavirus crisis. So, here's the central mystery we're looking at. How does a state-of-the-art vessel built for pristine polar exploration and amazing wildlife encounters end up battling a rare, invisible pathogen? I mean, this wasn't some rundown ship. It was a meticulously maintained floating fortress of luxury that suddenly found itself totally outmatched by a microscopic threat. Okay, let's dive into this. The contrast here is just staggering. You've got passengers paying top dollar. We're talking anywhere from 14,000 to 22,000 euros for a 33-day Antarctic odyssey. The expectation? Unparalleled views of penguins, seals, and completely untouched islands. But the reality? It turned into a terrifying floating medical emergency, complete with rapid evacuations, onboard isolation zones, and a massive international health alert.
Part 1. A luxury voyage turns deadly.
Let's walk through exactly how this timeline unfolded. On April 1st, 2026, the MV Hondius set sail from Ushuaia, Argentina. Everything is picture perfect, right? You've got 175 passengers and crew from 23 different countries. But just 5 days later, on April 6th, the first very subtle symptoms start showing up. Because they were out in such remote waters, the situation escalated rapidly, leading to the first fatality on April 11th. By May 2nd, things had deteriorated so much that the World Health Organization got involved, triggering a global alert, until the ship finally docked in Tenerife on May 10th. And the human toll behind these dates is just absolutely heartbreaking. It started with a 70-year-old Dutchman complaining of a fever and muscle aches. Tragically, he passed away at sea. His 69-year-old wife disembarked with his remains, but she also fell incredibly ill and died in a hospital a few weeks later. And then, around May 2nd, a German woman in her late 60s succumbed to similar symptoms. Now, what made this a real nightmare is the incubation period. Hantaviruses can take anywhere from 1 to 8 weeks to show up. So those early symptoms, they were just brushed off as seasickness, completely masking the danger spreading in the confined environment of the ship. That brings us to a really crucial number: 8. There were 8 confirmed cases in total from this single voyage. Now, 8 might sound tiny when we talk about global outbreaks, but in this context, it's monumental. This was literally the first known hantavirus transmission cluster ever recorded on a modern passenger cruise ship.
Part 2. The Andes virus threat.
Now, what's really interesting here is the hard science behind the pathogen. We're dealing with hantavirus cardiopulmonary syndrome, or HCPS. This is a severe respiratory illness, and it moves fast, straight from basic flu-like symptoms to life-threatening shock. Normally, you only get this by inhaling tiny aerosolized particles from infected rodent droppings or saliva. The truly scary part? There's absolutely no approved vaccine and no specific antiviral medication. Treatment is pretty much entirely reliant on intensive, aggressive care in an ICU. But it gets worse. The MV Hondius wasn't just hit by any hantavirus. It was struck by the South American Andes strain. And this specific strain carries a terrifying 40 to 50% case fatality rate in vulnerable populations. When you look at the passenger list on the Hondius, a lot of folks were in their 60s and 70s, putting them right in the crosshairs of this incredibly aggressive virus. And here's the piece of the puzzle that literally set off those international alarm bells. Unlike most other hantaviruses, which only jump from rodents to humans, the Andes strain actually has a rare, scientifically documented ability to spread from human to human. It usually requires prolonged close contact, which is, exactly what happens on an expedition ship. That's precisely why health authorities reacted with such military-level precision. Part 3. Coordinated global response. And this brilliantly illustrates the massive international effort it took to lock this down. You had the WHO and the European CDCs sharing passenger manifests across borders. On May 3rd, health authorities from Cape Verde literally boarded the ship in open waters to drop off supplies and set up strict isolation zones. Then, when the ship finally docked in Tenerife on May 10th, they evacuated 94 passengers on coordinated charter flights before routing the whole ship to Rotterdam for a massive professional deep clean. So, where do things stand right now in the aftermath? Well, 6 of those cases were officially lab verified as the Andes strain. Currently, 4 patients are still fighting it out in hospitals across Johannesburg, the Netherlands, and Zurich. Remember that crazy long incubation period? Because of that, all close contacts have been placed under a strict 8-week monitoring window. Thankfully, the WHO says the risk to the general public is low, which means the rapid containment actually worked,
And it's definitely worth mentioning that Oceanwide Expeditions cooperated fully with authorities, stepping up to cover all the medical and flight costs for those affected.
Part 4. Lessons for future travelers. Let's move to how this builds into real, concrete recommendations for mitigating future risks. By nature, expedition cruising gets you up close and personal with remote environments, places where these pathogens just naturally thrive. So experts are pushing for 3 big changes: heavily enhanced pre-travel medical screenings, incredibly strict rodent control audits at every single port, and a massive push for passengers to use personal protective measures when going on shore excursions.
Look, if you're planning a trip to a remote region, this advice is absolutely paramount. You have to consult health advisories and report any flu-like symptoms, fever, chills, muscle pain, instantly, because there's no cure for this. Early recognition and getting to an ICU fast for mechanical ventilation is literally your only defense. In these situations, time is everything.
Ultimately, this whole tragedy serves as a huge wake-up call. You can pay 22,000 euros, you can book the most luxurious suite with panoramic views, and you can visit the most pristine corners of the planet. But even the most carefully curated adventures carry invisible biological risks. Microscopic dangers, unfortunately, do not care about luxury. Right now, scientists are deep into advanced genetic sequencing to figure out exactly how this virus snuck aboard the Hondius in the first place, whether it was back in Argentina or on a seemingly innocent shore excursion. But as we wait for those answers, we really have to ask, how will our illusion of safety in remote expedition travel change forever? Thanks so much for joining me for this explainer, and for more, visit our website, Fair Solution.